Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And here I am today with LaShea Haynes, and we're going to chat about her upcoming presentation in our Labor and Delivery Symposium of 2024. Welcome, LaShea. It's good to have you here.
Oh, thank you so much. Thank you. I really appreciate being here.
You have a very important presentation titled External Fetal Monitoring and Avoiding Liability, Sharpening Your Documentation. I am so looking forward to this, and this is so needed. But before we get into this, tell us a little bit about your background, your professional background.
So I have been in OB 28 years. So I've been a nurse 28 years. I've been in OB 28 years. So everything I've done in my nursing career has been in OB. I've been an outreach educator. Always loved education. I really kind of tried to decide between being a teacher and a nurse. And when I found out that nursing really does provide medical education, I said, sign me up. And I've been sold ever since. I'm a board certified clinical nurse specialist. I did that for about 13 years. And now I'm back at the bedside. And I do that. I do a little bit of that. And I am the editor of AWON's Healthy Mom and Baby magazine. And so great reputable website that you send your patients to. It's healthformom.org. We have one of our magazines. So it's part of our
beautiful
professional organization. So healthformom.org. So I'm the editor for our AWON magazine. And then the other 1/3 of my time is spent in perinatal potpourri, which is my business and teaching C-EFM certification courses, fetal monitoring in services, like what our audience is going to get a little bit of today, and fetal heart monitoring courses through AWON.
Wonderful. Thank you so much. And thank you for sharing these beautiful resources there. First of all, also the magazine and also your own, company for where you provide education. That's absolutely wonderful. And now let's talk about the topic, external fetal monitoring and avoiding liability, right? So here we are. We know monitoring, we have to do it and it's important. But also, and this is what I love about you, LaShea, because I had a little sneak peek about the presentation, being family-centered and really making the parent part of the care. So talk to me a little bit, because I feel like we're always a little bit rushed, a little bit, there's a lot going on. We need to document, we need to get everything right. But we also want to make sure that we really, being there for that parent and making them part of the care. So tell me a little bit about that.
So, and we do touch on that. We actually touched on that for those, I don't know how long you archive your things, but if they do sharpening your skills last year, they'll get a little touch on that, and sharpening their skills this year in fetal monitoring, they'll definitely get a little bit of touch of just that shared decision-making and how important autonomy is for our patients, reminding us our role is nurse advocacy. So we're really that middleman in between that patient and the healthcare provider. And so our whole job is here to provide, support, resources, autonomy, education to that patient. And so, we'll definitely delve into that in the presentation and talk about how important that is to say, you get a choice, but here are the risks and benefits too, to go with the choice, not just, would you like me, or are you okay with us doing XYZ? And then a yes or no. That's not really giving them,
no.
I mean, I know the risk and benefits behind it to really make a educated decision.
And this is so important. I'm glad you just mentioned it, because just by posing the question, are you okay with that, or we're going to do this, is that all right with you now? As you mentioned, that's not really a choice, because the family, the parent doesn't even know what often that entails, or what are the risks and the benefits. So breaking it down, making sure, because we know what that means, but the family doesn't. So it's so important to really go a little bit into that, and and give them that informed choice, and even giving them a little time to decide if this is, of course, not a dire emergency or something like that, but so they have time to a little bit think that over, and that. Now let's talk also about documentation, right? We know we always hear that in So as in our training, if it's not documented, it didn't happen. Or,
Mhm.
So how do we do this in a way that we protect ourselves, but also provide enough good information, relevant information in there that is not too vague and really covers us, but also has that advocacy role, as you mentioned, for the family, the parent, and the patient there. And it's
So,
wonderful.
the funny thing is, I kind of give the opposite advice as far as if you didn't document it, you didn't do it. I'm one of those that don't really feel like that's true in every instance.
Interesting.
And so I often give the example, I have 3 kids, and I have 3 grandkids. If I'm not assessing they're not 2 yet. I'm not rushing them to get there, but when they get to the terrible 2s, and I have 2 of them, and if I'm assessing and watching them, am I going to have time to document it at the same time? You know what I mean? Like, how long can you keep your eyes off 2-year-olds? Maybe a
Yeah.
minute and a half at the most, or otherwise, right?
Yes,
A marker on the
absolutely.
walls, or you almost can't take your eyes off of them. And so I can remember they're only 3 months old. And it was hard for me or my daughter. You talk about documenting. We couldn't get to the phone to just text. Like, it was like,
Right, right.
we couldn't. So there wasn't time. There really wasn't time to document, right? Because we were assessing. So I think you make the time for the documentation when you can. And the key was what you said of making sure that when you do your documentation, when you do get to it, that it has the essential components, not too much, just enough, right? That the whole rule of charting by exception is something we've learned, in nursing school. And so when there is that exception and we do need to write more than just status quo, everything's within normal limits, we'll go into that in a PowerPoint about, what, how to make the most of your time, your assessment time, and the time that you are putting to the side for you to document.
Yeah, interesting. I'm so glad you mentioned that, because I think so many people are, under that, or, grew up with that knowledge if it's
Mhm.
not documented. But you're absolutely right. How can you, in a moment, and your example was so perfect, talking about a toddler there, you can't take your eyes off. So you really have to, make that right decision to document when, when it's appropriate, without, taking your eyes off the ball when it's really, really important. Absolutely. Yeah, absolutely. That makes so much sense. So tell us a little bit more what you think, what you hope our viewers will take away from this presentation here.
So I think as you develop, one of the things that we talk about is professional practice, professional development. And as you grow within your OB and your perinatal nursing career, professional development and just sharpening your skills are so important. No pun intended. And so the course will just really help to give you those aha moments that you need to get you through the next time that we're back again, seeing each other. So I think that you'll enjoy those tips, and they're going to make you a better nurse and a better advocate. And I'm just ready.
That's absolutely fantastic and beautifully said. Well, thank you so much. And before I let you go,
Mhm.
final last word. Give us one little tip, little nugget of wisdom here from your side.
I guess I'll give you my 2 favorite hashtags. Can be
Yes. Okay, great.
my final thing. So one is Rose Horton, who was the first Black American president of A1, and she will be the president again in January 2025. So we're very excited. Her hashtag is not on my watch. And I think with maternal morbidity and mortality being the way it is in the United States,
Yes.
she has kind of launched that it won't happen on my watch. And I absolutely love that.
Yes.
And told her, hey, you should coin that, like that's yours, and I even wrote that up for her, and she won an award, by the way, and I hear it locally in our AGC. So very excited about that. And so just, not on my watch is my one big one, right? It won't, as much as I can do when I'm with my
Yes.
patients and I'm with them every day to make sure things don't happen on my watch. And my second one, A1 had a hashtag a few years ago that was care boldly. And so I often use that care, and I use the boldly in capital letters. I don't know if it's okay, but this is my it's getting in from school. So care boldly is my another hashtag. Sometimes it is you have to be bold. Sometimes it does take courage to speak up for yourself, for your patient, to be an advocate, to have crucial conversations with healthcare providers. I mean, our job just requires so much of that. Those are my 2 favorite.
Oh, thank you so much. That is really, really beautiful. Care boldly. It really speaks to me, and I think to many of our viewers here as well. And of course, the hashtag not on my watch as well. Thank you so very much for being part here at the Labor and Delivery Symposium to this year of 2024. It has been such a pleasure having you here at Gold, and we hope to have you back soon again. Thank you so much, LaShea.
Oh, you're so welcome.
And now some information for our viewers. If you're excited to find more about LaShea and her presentation here and all the other fantastic presentations of the symposium, we invite you to go to goldlearning.com to find out more. Thank you everyone for watching and have a lovely rest of your day. Bye-bye everyone.